signed in tonight will send you an invitation to join iContact and be part of our newsletter. And Owen actually is my publicity guy. He's a journalist, so he makes it look much better than I would. Actually, I could make it look that good, but it would take me like weeks. So it's nice to have somebody who can do it in a couple of hours instead. But we communicate and try and get a newsletter out. During the session, we did about every 2 weeks.
Yeah.
And during this interim, our plan is at least once a month to get a newsletter out. And I liked doing town halls where I brought in people and had different things discussed. I did one a couple of months ago on medical marijuana. I brought in some doctors who were pro and con. Unfortunately, the pros outweighed the con, but my con guy was, you know, very strong, so he did a good job. I owe him dinner. But you know, and then I had brought in a gentleman who did stuff on payment reform and healthcare, because I think it's always good for people to learn about these issues that you're hearing about a lot on TV and have some better understanding than just a soundbite, and whenever possible, have pro and con in that thing as well. Because one of the things I was told was that when a lobbyist tells you, you know, that they want you to vote for something, to always say, well, what are the people saying who don't want me to vote for this? And then obviously talk with them as well, but because you can't trust them, unfortunately. But it's really helpful because often people whose lives will be impacted by these decisions can give you the best information about what unintended consequences might happen that you weren't even thinking about. So that's fun. So yeah, it's Aguilar for 32, Aguilar 4, all written out, and the number 32 is my website, and you'll find stuff on there. And then we'll hopefully get you on our mailing list today.
Can I just say one thing?
Yes.
I'm looking at the list now, and there's several addresses that I can't read.
Oh, okay.
So maybe if you could come back and maybe fix them so I can. It's kind of hard to enter.
You understand, this is Susan Montine, and she worked with me during the session as my aide at the Capitol, and is going to help me between sessions starting my campaign. As many of you know, I was selected by precinct committee people to take Chris Romer's spot when he resigned to run for mayor. And because he had just won his slot, I only get the first 2 years of his term without an election. I actually have to run for the last 2 years in November of 2012. And since I've never run for a seat before, we're sort of working together and talking with people about how do we do this, what do we need to be doing. And so that's part of the other reason why I walked around neighborhoods and put flyers up, because if nothing else, they'll remember my name, that they'd seen my name somewhere before, and hopefully read a little bit of the information we gave on the invitation to the town hall. But so I'm hoping to walk around a lot of the district. I'm going to focus on Southwest Denver in the beginning and walking. I did this because the town hall was here, but as some of you may know, because of the new census, they're doing two things this year. They're doing redistricting, which you heard about a lot in the news, which is deciding where the new congressional districts will be drawn for our U.S. representatives. But they're also in the process of doing something called reapportionment. And reapportionment is redrawing the lines for the Senate districts and the House districts. So none of us will really know where our Senate or House district will be until they finish with reapportionment. And at best, that'll be November. So between now, but we do know that they will keep where you live in the district. So I was told if I go, you know, a mile around the radius of my home, that's probably pretty safe, that I'll still have those areas in my district when it's redone, but I don't know beyond that what the district will look like. And just like with reapportionment, there's a lot of concern about, you know, do we make them competitive districts? Are we going to end up giving too much of a bias to one group or another? Denver tends to be fairly heavily Democratic and unaffiliated, and they are going to try to keep Denver people together, but we do need to lose half a seat, so or gain half of somebody else's seat. So there'll be another senator that's from outside of Denver that will be part of our mesh as well, probably. So I'm not quite sure where the district will be until November. If this is something you care about, they are doing a public hearing in July 11th at the Capitol. I think it's between 10 and 12, but it's on my website, where they'll be discussing how the Denver-Arapahoe Jefferson County boundaries are being drawn for Senate and House.
Is it something we should care about?
You know, yes. Yeah, probably because it can determine the outcome of elections, depending on how things are fixed or not fixed.
Did you say that this area will almost certainly remain in 32 in your district?
Oh, no, so where I live will
Where you
definitely
live. Okay.
remain in 32. I'm not sure what will happen with this area. You know, I had a couple of people ask me whether Chris Romer would be coming back to run again. And actually, I'll tell you that Chris actually called me after the mayoral race and offered to support me and give me help in running for re-election. So, so that's, if anyone was wondering, that's not going to be a concern. I'm not sure if he could have, anyway, to tell you the truth, because he had won 2 seats, but he was very gracious and kind and gave me a call. So, any other questions or comments?
Do we have any time to talk about the health exchange thing? Because we're only how does your health exchange bill reconcile with Amy Stevens or that thing that came out of the House?
Yeah. So the bill that passed out of the House and the Senate, Senate Bill 200, establishes the Colorado Health Exchange. And for those of you who've been following national politics at all, as you know, President Obama passed the Patient Protection and Affordable Care Act. And part of that is that each state needs to either have their own exchange or has to join some other exchange in 2014. And if you've been following the news at all, you know that a lot of states are, there are a number of states involved in lawsuits around whether the law is legal or not, because they're saying you can't really force people to buy insurance. They're fighting the individual mandate. But the fact of the matter is, it is the law of the land today. It's been passed, it's been signed. And so Colorado was able to come up with a bipartisan bill, because we have a divided House and Senate right now, Democrat and Republican, to at least begin the process of starting an exchange. And all the bill really does right now is it says how many people will be on the board of the exchange and what their qualifications will be. And then it also set up, Representative Stevens felt really strongly that she wanted there to be a legislative oversight committee for the exchange, because she didn't there was very much concern by the business community that somehow the game would be rigged with our health insurance exchange. And so there's a 6-member, or no, it might be 8-member, legislative oversight committee for the exchange. And I am going to be part of that, which is great, because it's a topic I'm very familiar with. The bill that I ran was completely different. So this is something that had to happen in terms of implementing the federal law in Colorado, and that's why there was so much tension around it. A number of states were not able to get an exchange bill passed because there was so much division about it, and a number of states are joining things to say we want out of health reform, period. So it was that, for that reason, it was monumental that Colorado got something passed. The problem with the exchange is that what it does is it guarantees you access to health insurance, which, as some of you may know, does not necessarily guarantee you access to health care, because sometimes insurance only pays for catastrophic things, and people don't purchase and buy the very basic things that can keep them from having those catastrophes. And so I'm a proponent of universal health insurance as a doctor, seeing people all the time who don't take care of themselves because they don't have the money to spend $10 or $20 a week on medicine, have something horrible happen that then means that we have to keep them on Medicare or on dialysis for the rest of their lives. I recognize the value of prevention and controlling diseases early. So I have been running a bill around comprehensive health care reform. But all that my bill would have really done actually was set up a feasibility study and a blueprint for how that might have been implemented in Colorado. For political reasons, I couldn't lobby it until the exchange bill passed, so there really wasn't enough time for me to try and really get it through. And so I will probably go ahead and try again next year, because I do still feel like we need to completely redesign how we pay for health care in particular. And not only how we pay for it, but what we pay for it. I actually was at a conference last week with 2 Republicans from the House. Senator Nicholson and I were the representatives from the Senate. It was with the Center for Disease Control, and they wanted to talk with us about, as legislators, winnable battles in public health. It's interesting that Carol mentioned that the only tax we passed was tobacco, because the correlation with tobacco taxes and quitting smoking is really dramatic. The other thing that's really dramatic is when you quit smoking, immediately your risk for stroke and heart attack declines. It's not just a 15 years out you benefit, it's an immediate benefit to your health. But anyway,
So we should put a tax on fast food.
maybe. With that meeting last week, one of the things for me that was exciting, because I'm so interested in healthcare payment and reform, was that they had a speaker from IBM, and IBM is a big corporation, so they pay for their employees' health care themselves. They self-insure. And this guy was up there saying, music to my ears. He said, you know, we found out that there are people who are so sick that you shouldn't charge them anything to go to the doctor, and you shouldn't charge them anything for medicine, and now we do that. And I thought, yes, big business has it figured out. That gives me a fighting chance. So it was pretty cool that they're figuring this out on an economic model, which is sort of what my clinical